Dr. Suparna Banerjee. I am an infertility specialist and a gynecologist. Today we are going to discuss a very important and pertinent topic that is called cervical pap smear. So what is that? So let's see this model. So this is our female reproductive organ. This is uterus, and the opening of the uterus which opens in the vagina, that part is called cervix. So the lifetime risk of developing cancer in this part, that is cervical cancer, is very high for any female in the world, and in India it's the highest number of women who had got cancer, that is cervical cancer. So prevention is available for this cancer. Not for every cancer, we cannot prevent cancer, but if there is cancer, we need to have a treatment like radiotherapy, surgery, chemotherapy, whatever. But this is the type of cancer where there is a long period before cancer where we can diagnose, and if we diagnose, we can prevent cancer, we can prevent this progress to cancer. So it is a simple test. Whenever we see a patient of reproductive age group like 25 to 50 years, so we recommend you should do a cervical pap smear. How we do it? Just a speculum examination, and we see the cervix and we take some samples from there, and then we send it to the lab to check for how likely this is having a chance of developing cervical cancer. Now it can be done in two ways. One is normal pap smear, another is liquid based cytology. So wherever which facility is available, we should use that facility to diagnose it early. So the sole motto of the thing is that we have to prevent the cancer happening, and we have got plenty of many more years to which, so that that time if we do the test and we diagnose it before, then we can prevent. So how frequently we need to do it? Is it for the lifetime we need to do once? No. So once your cervical pap smear is normal, we always tell you that you should repeat it after 3 years. If it is abnormal, then what do you do? If it is abnormal, then either your gynecologist will refer you for another test, that is called colposcopy, or if it is depending on what abnormality we are getting, or sometimes we just repeat the test after 6 months, and then we take the decision if we need to do anything. If it is normal, then again routine follow-up after 3 years. So that's how a robust I think network is available in the world, and in India, though in the government setup, in the private setup, everywhere cervical pap smear is available. So if you have never done it in your life, please do it. Go to your gynecologist and please ask for it. And if you do it and it is normal, then we reassure you nothing needs to be done. But if it is abnormal by chance, then there is treatment available, so that you early opt for the treatment and prevent cancer. And regarding vaccine also, I will say that HPV vaccine to prevent cervical cancer is also available now. If somebody is taking vaccine, do they need to have pap smear? The answer is still yes. Because if you do take the vaccine, it's not that 100% cases you can prevent cancer. So till there is a need for pap smear to be done. So if you take vaccine, then also you need to take this, do this pap smear. Otherwise also, if your age is higher side and you cannot take the vaccine, then also you should do a cervical pap smear. So basically an expert needs to see your cervix, and a pathologist need to see the cervical cells to check if there is a chance of developing any cancer or cancer related changes. So if you do it, then it's very reassuring if it is normal.